I'm Dr. Kat, a board-certified plastic surgeon, and I am honored that you chose me to be your plastic surgeon. As my patient, you have a responsibility to follow your pre- and post-operative instructions in order to ensure the best possible results. Plastic surgery is not a destination. It is a journey, and along this journey, there are steps that you must follow in order to ensure that it is exciting, enjoyable, safe, and an overall wonderful experience. So please watch this video carefully as I review your instructions. Now, myself and my medical assistant, Veronica, will review the pre- and post-operative instructions for your surgery.
Hi, I'm Veronica, Dr. Kat's medical assistant. I'm so excited for your upcoming surgery and to be a part of this journey along with you and Dr. Kat. I'm here to give you all the information and instructions you need in order to have a successful outcome.
So, Veronica, how do you think we can make people remember the instructions and follow them? Should we just send them the video like over and over again?
I just wish I could follow them around and make sure they follow all the instructions.
Well, I know that sometimes you just try to scare them and tell them this could happen, like your skin's gonna die.
I know, my scare tactics are kind of rough,
but I think
though.
then they have like nightmares. Like I've had patients tell me, oh my God, Veronica told me if I don't listen, then...
I'm just trying to warn them because I told them if they don't follow instructions, Dr. Kat will be upset.
Oh yeah, no wonder they come and they're like, don't be mad at me, but I accidentally, blah, blah, blah.
I know, they have like this fear. No, but it's really important. That's why I do that.
No, it is important, and I think a lot of doctors don't emphasize proper post-op instructions, and then they have some outcome, something happens, and then it's too late. So in the end, I just want everyone to be able to follow instructions and have a good result, not mess up anything that I've worked so hard to do.
Exactly, I agree. As long as they follow their instructions, nothing should go wrong.
Maybe if we make the video more funny, then they'll remember it better.
I feel like we're pretty funny, right? People think we're funny.
Sometimes I'm funny. I don't know. Most of the time I'm pretty serious. Okay, so let's start with 2 months before surgery. Okay, so 2 months before surgery, Veronica, what's the most important thing?
To stop smoking.
Yes, and this includes, first of all nicotine products, so gum, electronic, anything with nicotine in it, and then also the other inhalants that they also ask about.
Don't smoke pot, yes, that counts. Nicotine gum, things like that, hookah, don't go out to the bar, just please.
But yes, also this includes any inhalants because obviously while you're under anesthesia, you'll be on the anesthesia machine. So anything that affects your lungs will affect the way that you recover from surgery and also minimize complications. So please, no inhalants, no smoking, no nicotine of any kind. And nicotine can interfere with the blood flow to the skin, and that affects wound healing. So potentially your skin could die, fall off, your wound's not gonna close. So please, it is very important.
The last thing that you want is to have this beautiful fat grafting to your booty and then it's gone because you smoke.
I will literally cancel your surgery if you do not follow the nicotine instructions. So please do not smoke anything.
I've seen it happen.
Okay, so then also around this time, you're gonna need to have help after surgery. I know that some of you feel really heroic and you're super tough, but really you need to have some help. So call your friends, family, anyone after surgery that you think.
Anyone that will help you.
And also, you cannot drive after having anesthesia. You cannot throw yourself in a cab. You need to have a responsible adult for the first 24 hours.
Yeah, and Uber doesn't count either because you're gonna be by yourself. We need somebody who can drive you home, get you settled, make sure you take your medications so that you'll be recovering in peace.
And also, if you are having a more extensive surgery, you may need to stay in one of our plastic surgery aftercare facilities, so they will be able to help you. And if you want to stay for more days, just let us know. We'll help you arrange that.
I know, I want to stay there. Can I just go and stay there for a little? I have them pamper me, take me to the bathroom, give me my medication.
They'll wash your hair.
They do everything for you.
Your drains.
You need to go there.
They'll get stuff for you. Now, 2 weeks before surgery, so this is where it really becomes important. You really need to pay attention. It is so important to stop all aspirin, Motrin, ibuprofen, Aleve, vitamins and herbals, alcohol, 2 weeks before and after surgery. Even my daughter knows this. She repeats it a ton of times because I say it so much.
Just cleanse yourself. Take the opportunity to make sure that your body is nice and clean for any additional substances, and do not take Advil. She will cancel your surgery because of Advil too. Yeah, no, even if you have a headache, take Tylenol. Don't take Advil.
Yes.
If you have cramps, take Tylenol, not Advil.
And if you have any questions about something, please ask. But in the end, you're just going to be able to take Tylenol. And pretty much you're going to have to stop everything else. Because all those other things could potentially make you bleed in surgery. And as you know, I hate any blood in my surgical field. And I want you to have a really, really great, easy recovery.
2 weeks before surgery, please do not overexpose yourself to the sun or get a sunburn.
Yeah, you really do not want to have your skin peeling off in my surgery site. Please do not do that.
Save the bikini body for after the surgery.
Yes, then you can safely tan with sun protection, of course.
And you can show everyone how you look.
The week before surgery, please let us know if you have a cough, a fever, any illness, or if you have any sort of skin changes or infections. If you are feeling sick or have a cough, please do not take over-the-counter medication without asking us. You also want to start thinking about what you'll need going into surgery. Most importantly, pick up your medications. Don't wait till last minute.
I don't want to be running to the pharmacy during your surgery because the nurse tells me, oh, she doesn't have this, or oh, she doesn't have that. So please prepare ahead of time.
And when you go to the pharmacy, you can also pick up the special soap that we recommend, the Hibiclens. You should be able to find it in almost all pharmacies in the cleansing aisle with the alcohol and peroxide. It's a green bottle. It's really easy to find. And also the TED hose. So we recommend using TED hose that is above the knee because when you're recovering from surgery, you don't want to be constantly pulling them up. They have thigh-high ones, and they don't have to be overly tight.
No. Please don't get them too tight because then we can't get them off of you.
Yeah, so less than 20 millimeters of mercury, anything that feels comfortable because you're going to have to be in the TED hose for at least a week after your surgery. It helps with your circulation and prevents you from getting a blood clot.
So 2 days before surgery, we want you to cleanse your body with the soap that we told you about. And
The
just make
Hibiclens.
sure you wash it really good, keep it on for like 2 minutes, scrub in all the creases, in between the breasts, underneath.
And the belly button. The belly button.
Yes.
We have found all kinds of things in the belly button.
Get a little
I will
Q-tip.
personally clean it in your surgery. However, please, if you can remove bacteria, all kinds of lint, debris from your belly button before surgery,
Yeah.
that will help keep it clean, minimize any chance of infection.
And your back as well. Make sure you scrub your back because you don't want to be on the operating table and they're cleaning you and they notice like they didn't clean their back.
Also, shave. Please remove all hair from areas around your surgery site 2 days before so you don't have any open cuts or wounds. So shave and start using the Hibiclens washes 2 days before surgery.
We don't want Dr. Kat to have to search through a national forest to find her incision site.
Yes, and we'll just end up, the nurses will end up shaving you on your operating room table, and it's just gonna, you're gonna pay for that extra OR time. So just don't do that. Shave before.
So 2 days before surgery, also please try to stick with a light diet. So even though you're not going to be able to eat after midnight the day before your surgery, don't go to the nearest In-N-Out and get a burger and fries.
Yeah, don't go to Disneyland and pig out because I actually had a patient who did that.
Yeah.
And when I did, because you don't want to be bloated during your surgery, some of the pain medication may also make you constipated, and you just don't want to be full of food and constipated after your surgery. You'll be miserable.
Trust me, it's not an issue that you want to have. You want to be able to focus on recovering and not be worried about your bowel movements.
Yeah, so eat light the day or two before surgery. Okay, so the night before surgery,
Oh, we're getting closer to your transformation.
please do not eat or drink anything after midnight, and this includes drinking water. Now, you can take your medication if you have high blood pressure pills with a small sip of water the morning of surgery, but otherwise, please do not eat or drink anything the night before surgery.
That also includes mints, gum, anything that you put in your mouth. Please, just midnight, nothing.
Also, please do not put lotions, deodorants, creams, or anything like that on your skin. I'm going to be marking you just before we go into surgery, and so that will keep me from being able to mark you appropriately.
And also, you don't want to wear any valuable jewelry or contacts to the surgery
Yeah,
center
we
the morning of
trust
surgery.
our nurses, but hey, if it's like
We just
something, yeah.
can't be responsible.
Not us.
You be responsible.
And also just wear loose, comfortable clothing. I mean, please do not wear super tight leggings or pants, just something that you can get in and out of easily. So now we'll review the instructions for abdominoplasty or tummy tuck surgery.
So after your tummy tuck surgery, you'll be spending the first night of recovery in an aftercare center. And you can definitely spend more nights if you'd like.
So when you wake up, you will be in a compression garment, and the most important thing is to keep the garment straight. You don't want to have any folds or creases or bend in it that will either make a permanent line or impression on your body or create a tight elastic band that may interrupt the circulation. So please be conscious of this during your entire recovery.
You're going to be in this compression garment for 6 weeks. So get to know it and love it.
Also, you will likely have drains, usually 2 or 3 drains after your surgery, and you do not want to get the drains wet. So you can bird bath around the drains, but you will have to wait until 2 days after the drains are removed in order to take a full shower or get your entire body wet. And for the drains, you will record the output every 12 hours.
Every 12 hours. So pick a time, 9 a.m. and 9 p.m. Record the right, middle, and left amounts of the output, and then let us know, and we'll decide, Dr. Kat will decide when the drains are able to come out. Usually it's between 7 to 10 days.
Yes, and if you are having liposuction at the same time as a tummy tuck, or if you're revision tummy tuck, sometimes it does take longer, so do not be alarmed if your drains need to stay in longer for about 2 weeks, sometimes 3 weeks. It's part of the course of having drains, and everyone is a little bit different in terms of how quickly they heal. Special positioning for tummy tuck surgery. So in the tummy tuck surgery, I'll be removing skin, pulling it down, and tightening it. So the first week, and sometimes even the second week, depending on how well you're healing, you will have to walk bent over. And I mean bent over, let me show you,
yes,
Veronica. It's gonna have to be like this.
Really bent over.
We're talking about 20 to 30 degrees. So I know that you're gonna feel great after your surgery. Most of my patients are off prescription pain medication after a day or two.
It's crazy.
But it's still important to protect your surgery site. You don't wanna create any undue tension on my repair. So please be conscious of that. And if your back is sore or you tend to have back pain, you can get a front wheel walker from the pharmacy.
Yeah, those are awesome. Our patients come in with their walker, they put all the pressure on the walker, and then it relieves your lower back.
And when you are lying in bed, the same position holds. So you need to be sitting up, propped up with several pillows. Flex your knees so that way you're always bent, especially for the first week. It is very important.
And after the course of the first week, you'll feel that you're able to stand up a little bit straighter, and it just takes time for your body to be able to adjust to your new tight and flat, awesome tummy.
Now, activity. So the first night of your surgery, you will need to start walking. And you're gonna walk every other hour, nothing crazy or strenuous.
Yeah, just walk around the house or just make sure that you get your blood flowing.
Yes, and you will also need to make sure that when you're getting in and out of bed, you're not using your stomach muscles. So have someone come from behind and help you out of bed, because I'm going to be putting a lot of sutures in the abdominal area. We do not want you to create any tension on those particular sutures. So the first 2 weeks, just gentle walking.
Yep, very carefully in and out of bed, and you can stand straight up as needed.
After 2 weeks, you can do more extensive cardio like walking uphill, but you'll have to wait for a full 6 weeks, six weeks before you do any exercise or heavy lifting. Did everyone hear 6 weeks? Because everyone always asks.
How many weeks?
6 weeks.
6. In your recovery after having a tummy tuck, you'll just start your normal diet as tolerated. So definitely we'll start you on clear liquids, and then you can gradually move up to the normal foods that you eat.
We just don't want you to get nauseous, especially that first 24 hours after surgery when you may still have some anesthesia in your system. If you're taking prescription pain medications, you just want to take it easy on the food, because we do not want you to throw up right after you have your tummy tuck surgery. After that, just stick to healthy foods that are rich in antioxidants and protein. Those are all great for healing.
So at around 3 to 4 weeks after your surgery, we can begin thinking about the scar therapy treatment, meaning what we're going to do to make sure that you have the most invisible scar as possible.
And as you know, just please keep in mind, it does take a full 2 years for the scars to completely fade. All the sutures are dissolvable, and the tapes that we put on your incision, the steri-strips, will slowly roll off. You can just trim them, but at 3 weeks, when we do start the scar therapy, you can very carefully remove the steri-strips and start the scar therapy.
After your surgery, you also might be a little bit bruised and swollen, but that's totally normal. This will last for about 2 weeks after your surgery, but it actually does take 3 to 4 months for all the swelling to completely go down.
And it is normal to also have some bloating or feel a little full after your surgery, especially if you have a hernia surgery in conjunction with your abdominoplasty. And for that, you can sometimes stay bloated up to 4 to 6 months. It's completely normal. We recommend that patients start Miralax, Nonetheless, any of those type of anti-constipation medications are fine after your surgery, and you can do that even the night of your surgery to help with the bloating and the constipation.
So if you develop a fever or you notice any dark red blood going into your drains, then you can definitely call the office and let us know what's going on, and we will direct you as for next steps.
And usually if there is something that is an emergency, it's not subtle. You will see the drains start to fill with blood, you'll get immediate swelling, pain, bruising. It's usually not subtle. So if that occurs, then please call the office urgently. But other than that, a little bit of bruising, a little bit of swelling is totally normal. And then just relax and enjoy the process. Your anesthesia experience should be amazing. Like, you'll feel like you took the best nap of your life.
I know. I'm always jealous of the patients that they get to take like an 8-hour nap uninterrupted and then wake up looking amazing.
Think positive thoughts and support yourself with positive people.